Good afternoon. Today we will discuss the new topic of sympathetic. Today we will discuss the new topic, sympathetic drugs. Most important topic. Dense vasomotor reversal. When adrenaline is given, slowly, intravenous or subcutaneous route, moderately rise the blood pressure. Then if adrenaline is given, after that administered the alpha blocker agent, that is dihydroxy ergotamine, it's fall only the blood pressure. The Sir Henry Dells noted that this biphasic response was converted into depression response by prior administration of ergot extract. It is due to alpha receptor blocking action of ergotamine leading to stimulation of beta 2 receptor by adrenaline, and thus causing fall in blood pressure. This phenomenon is known as is known as Dell's vasomotor reversal. It's so important. See it very briefly again. Adrenaline is given intravenous and the subcutaneous moderately rise the blood pressures. When adrenaline, if adrenaline is given, then after given the alpha blocker, that is the hydroxyergotamine, they fall in blood pressure. How? The scientist Sir Henry Dales is noted that is found the biphasic response. He was found the biphasic response. That response can be converted to the stimulation to the depression response by prior administration to the ergot extract, that is dihydroxyergotamine, prior administration to the ergot alkaloids, and then response is followed. Why? Because it is due to the alpha receptor is blocking action of ergotamines and leads to stimulation of beta receptor, and then automatically there falls in the blood pressure. This phenomenon known as the Dell's vasomotor reversal. Now previously you can study the graph. See, it's a normal graph. The frog, it's a normal graph. Normal graph. Now peak is like that, is for contraction, peak is fall down, that is for relaxation. The RD show contraction and the relaxation, that is a normal graph. Now here it's a normal. Now here is administer adrenaline. You can give the adrenaline injection 0.2 ml. Then what happen now? Adrenaline is stimulate the beta 2 receptor in the cardiac receptor. Then what happen? Beta 1 receptor, they are stimulated. They increase the heart rate. Impact is there. And force of contraction. That's why it's called as positive inotropic and positive gonotropic effect. Adrenaline is act on beta 1 receptor, that is cardiac, due to stimulation of beta 1 receptor, increase the heart rate, increase the force of contraction, and increase the blood pressure. Hence it is called as the positive inotropic effect and positive gonotropic effect. Okay. Now here the Dell's scientist Sir Henry Dell's reversal syndrome. Now here is the adrenaline is given. Sir Henry Dell find out the biphasic response. Which? Biphasic response. Adrenaline by prior administration to the dihydroxyergotamine, that is dihydroxyergotamine, and blood pressure is fall down, that is called Dell. How? The graphically representations. Now here first here is adrenaline is administered. Is increase. It's a normal graph. then it's a normal. Then here is administered dihydroxyergotamine. Now that point is administered dihydroxyergotamine. Slowly they can depress the drug effect, then the blood pressure in fall downs. Then here administered the adrenaline, normal. Then again it show the fall down the effect, and blood pressure is a fall down. That is adrenaline show the biophysical response of Sir Henry Dell's. That phenomenon called as a dihydroxyergotamine. Understand? Adrenaline is given due to stimulation action of beta 1 receptor, increase the heart rate and these things. When dihydroxyergotamine is given, they act in the alpha receptor, the blocking is produced, they fall down the effect. Then adrenaline is given, then again they fall down, and then that response is called as Dell's reversal syndromes, that biophysical response of the adrenaline. Okay, now the next is action on second action on smooth muscles. Pharmacological action of adrenaline, there is called CVS, action on smooth muscle. The adrenaline is relaxed. Most of adrenaline relax most of all smooth muscle. Gut, GIT, bronchial smooth muscle, and uterus smooth muscles. It can be the relax. Radial muscle also contract in the eye. Radial smooth muscle contract, and it produce metricis, that is dilation of pupils. Adrenaline and isoperinylene. Adrenaline and isoperinylene in bronchial smooth muscle produce bronchodilation because of these act on beta 2 receptor, and they can relax the smooth muscle of bronchioles, and they produce the bronchodilation. So easy for take the breath. Commonly it is used to treat the asthma. Why why the adrenaline is the most important catecholamides are adrenaline and the isoprenaline. They act on the bronchial smooth muscle. They act on bronchial smooth muscles. They are the important catecholamine, act on bronchial smooth muscles. They produce the bronchodilation, and reciprocally they act in the beta 2 receptors. They should present in the smooth muscle of the bronchioles. Okay. Next, third effect on respiration. In the addition of that, it produces the bronchodilation property. Adrenaline is weak stimulator of respiration. Next should be the effect on CNS. Adrenaline has no marked effect on CNS because poor penetration in the brain. However, it causes restlessness, apprehension, headache, and the tremor is given in the CNS. Next is the metabolic effect. The catecholamines, which adrenaline, noradrenaline, isoprenaline, all the sympathetic drugs produce a number of metabolic effect. They produce a number of metabolic effect, and such they increase the in oxygen consumption and stimulate of the liver and skeletal muscle glyconeolysis and release of fatty acid from adipose tissue. These all the effect involved mediated by beta 2 receptors. And involve the activation of enzyme adenylate cyclase enzyme An alpha 2 receptor produce inhibitory effect. Inhibitory effect. You see, absorption, distribution, metabolism, and the excretion. The catecholamines are not effective by orally. Not effective. All the catecholamines are not effective by orally. It is generally given by the parental routes. Subcutaneous intramuscular routes. And isoperinylene is administered by inhalation as an aerosol. You know the aerosol very well. First year you have to study. They are metabolized by monoamino oxidase enzyme, that is called MAO, and catecholamine O-methyl transferase, that is called the COPT. Next topic is the side effect of side effects of catecholamine are due to the actions on CVS and the CNS. It caused by fear, that is apprehension, anxiety, chinta, worried, restlessness, headache, weakness. These are the main side effects of catecholamin. Then toxic dose of catecholamin cause overdose. Toxic dose means overdose. It causes arrhythmia. Heart rhythm should be in balance. Hypertension. Cerebral hemorrhage, that is brain hemorrhage. Cerebral hemorrhage. And acute pulmonary edema. These are the side effects. Side effect is caused generally administration action on the CVS and the CNS, fear, apprehension, anxiety, worry, chinta, restlessness, headache, thromboing headache, and the weakness. That is the main side effects of the catecholamines. All the catecholamines, that is adrenaline, noradrenaline, nor isoperenalines. And their toxic effect, toxic dose, that is overdose, causes by arrhythmia, rhythm of hearts. It should be change. Hypertension, blood pressure is rise, cerebral hemorrhage, brain hemorrhage, blood vessel burst in the brain and the blood clot found in the brain. And acute pulmonary edema is in the pulmonary arteries. Okay. Now the next, literature and the dose. Adrenaline or ephedrine dose is available 1:2000. Solution in 1 to 2 ml ampules. It can be administered by subcutaneous, intramuscular, or intracardiac, directly given into the heart, cardiac route. Very rarely use the intravenous. Okay. Second, noradrenaline. Its dose is available 1 mg per ml. It is generally given in intravenous infusion with saline infusion by 2 to 4 microgram per minute is given. After dilution 5% glucose solution. Next is the isoperilaline is given 1:5000 solution for parenteral use, and the inhalation 0.25 to 1% solution. Sublingual tablet kept in below the tongue, that is 15 to 20 mg tablet is isoperilaline is given. Okay. The next should be, you can study is a ephedrine. It is a non-catachonamine. Ephedrine is a belonging category of non-catecholic. It is alkaloids. Is having, it produces the action, direct and indirect action, direct and indirect action. It is directly, it is act on alpha and beta receptor, and by releasing noradrenaline, and this noradrenaline which activate alpha and beta receptors. It raises the blood pressure, stimulate the CNS, and bronchodilator effect in asthma. It is also used as nasal congestant, and it causes Metabolic Effect by 2 to 3% solution, means dilate the pupils. It is extensively used in treatment of asthma. It is commonly extensively used in the bronchial asthma. Next is amphetamine. The amphetamine action, it releases the noradrenaline And in the addition, it act on alpha and beta receptors in the peripheral effects. It is powerful stimulant. Amphetamine is a powerful stimulant action. Action is powerful stimulant. Orally is effective. It is commonly used in treatment of obesity. Obesity reduce the weight. Commonly used in the treatment. Now the last point is therapeutic use of sympathetic drug. Therapeutic uses. Drug like dopamine is used for hypotension. It is used in treatment of blood pressure. Dopamine drug are used to hypotension to restore the blood. Second, it is sympathetic drug used with the local anesthetic. It is used with the local anesthetic. Adrenaline, phenylephrine are used in local anesthetic and to reduce their absorption and prolong the duration of action. It is used to control the bleeding. It is used to control local bleeding. It is used in treatment of nasal decongestant, means cold, rainy days. Okay. Adrenal, it is used in treatment of cardiac. It is used in treatment of cardiac use. Adrenaline stimulate the heart. Stimulatory effect in heart. That why used in the cardiac use. Next, it is used in treatment of bronchial asthma. Beta 2 stimulant drug are used isoprenylene, commonly used in treatment of asthma. Next, it is used in treatment of allergic reaction. Adrenaline is a choice of severe drug for severe allergies. It is used in Metabolic. It is used in treatment of fundus examination. It is used in treatment of fundus examination because metabolic action produce dilate the pupils. Amphetamine used in the stimulatory effect, reduce the obesity. It is used treatment of obesity, Parkinsonism. It is used for anti-leptic. Okay. Now finish this. Okay, first off.